Okay, so today is going to be a big topic that comes up all the time. This is something that I hear people ask about. This is something that people want to know about. This is something that I hear people all the time getting when it comes to their back, and that's back pain injections, right? I hear all the time people saying, "Oh, my injection's coming up soon." When I ask them how they're doing, they say, "Yeah, it's coming up soon. I'm looking forward to my injection," right? So that's fine, right? You go see a doctor if you're in a lot of pain and the meds didn't work, the oral medication didn't work, you might be prescribed injections. Okay, so let's talk about what type of injections there are for back pain, what are the common injections that we see people getting, and then what the side effects are, what the benefits are, and if you should actually do it. Okay, so if you're thinking about getting an injection for your back pain or your sciatica, before you do this, here's what you need to know. Okay, so there are four types of back pain injections. Not all injections are the same, right? So people say, "I'm getting injection." It's important that you understand and ask your doctor or the person who's administering this, what type of injection am I getting? Okay, so each of these have different purposes. They have different risks. They have different effectiveness. So here's the breakdown with all that. Okay, first one, cortisone injection or steroid injections. This is the one that many people talk about when they think they're getting an injection. It's also the one that you'll see people get, like, the classic athlete trope where the athlete's getting a steroid injection into their knee, for example, on the football field. So what does that do? That cortisone, that steroid injection? Well, it reduces inflammation. Okay. So that's the big thing with that. Okay. The next one is an epidural steroid injection. Okay. And so these ones, they target nerve related pain. So sciatica, for example, right? Pretty common right now. If you're thinking you're watching this, you probably have sciatica, or you might have sciatica, or you maybe have experienced it. So if you have that and you're getting an injection, maybe that's the type of injection you're getting. The next uh, one that we want to talk about here is a facet joint injection. So these are used for spinal joint pain. Okay. And then the last one is a nerve block injection. So this one shuts off pain signals for specific nerves. Okay. So those are the four types: cortisone, epidural, facet joint, and nerve block. Okay. So how do each of these work? Um, all injections aim to reduce pain, but they work differently. Okay. So steroid injections lower inflammation, nerve blocks stop pain signals, facet joint injections help diagnose and relieve joint pain. But none of these fix the root cause of your pain. Okay. So first one, the cortisone injection. What does that actually do? And what do you need to know about it? So as I mentioned, the whole purpose of it all is to reduce inflammation. Okay, that's the number one thing, is we want to reduce the inflammation, and around the spinal nerves, right? Because you have these nerves there. Um, how it works is uh, it gets injected near the spine to calm those irritated tissues. And how effective is it? Well, it provides temporary relief. So it's like weeks to months long. All right. So think about that when you're doing this. Remember, this is short term. It's not a long term solution when you're thinking about that specific injection. I mean, none of this is. So just keep that in mind. All right. Um, and the risks for this are weakness, tissue over time. So it can raise your blood sugar, and it may cause weight gain in osteoporosis. Okay, so when the one thing with this weakens tissue over time, like the more you get these types of injections, eventually over time, you're going to break down the tissue. Okay, and we don't want that, because obviously, um, like over time, like you want to have healthy tissue, right? So if you're in that situation where you're getting multiple injections, that's where you start running into issues. Okay, so just be wary of multiple injections, because that's going to be a concern, right? So multiple injections, like if you're getting one, okay, cool, that might be okay. But if you're now getting multiple cortisones, not a good idea. Okay, next one here is the epidural steroid injection. Okay, so the purpose, as I mentioned before, is to target nerve pain, sciatica, for example, in this case, right? And how it works is it's injected into the epidural space around the spinal nerves. Pardon me. Its effectiveness, again, is short-term relief, right? So you may need multiple of these types of shots to actually get relief. And the risk here is it can cause nerve damage if misapplied. So I've heard of people who have actually went and got an injection. They said it was the most painful thing ever because the person hit the nerve. You can get spinal headaches and increased risk of infection. All right. Next one, the facet joint injections. Okay, so this is used for degenerative spinal joint pain. So how it works is a mix of anesthetic and steroid is injected into the small spinal joints. And really, how effective is it? Well, again, temporary relief. It's often used to confirm that the facet joint is indeed the source of pain, right? So if they inject that, they're not quite sure, like, oh, what's the problem? If they inject this and you see reduction in pain, then they now have identified that your back pain comes from a facet joint issue, okay? Again, the risks here are limited effectiveness. It may wear off quickly, leading to repeated injections over time. Okay, number 7 is the nerve block. Nerve block injections, they block pain signals from specific nerves. Okay, so it's an anesthetic plus steroid, and it's injected near the nerve root. And then how effective is it? Well, it can, again, provide that temporary relief, but it's not it's often used for a diagnosis. Okay, so if it works, then we know that there's some nerve issues. Okay, the risks here, again, temporary numbness is a potential risk, incorrect targeting, and in rare cases like nerve damage. Okay, so what is the problem with when we're thinking about injections? Like, what's the problem with this? Why is it you know, why wouldn't you get an injection, right? Those are all the reasons why they work. Well, here's why. As I mentioned multiple times, they only mask pain. They don't fix the problem, all right? If you don't address the cause, the pain will return. So if you get the injection and you're not addressing the root cause, well, the pain's going to come back. And if you're using using them as a long-term strategy, they can lead to a dependency and just more damage in the area, right? So it's just not a good long-term strategy. So instead of relying on injections, what you need to do is focus on restoring proper movement and strength. So what can you do instead of injections? Like, well, oh, that's great. Well, what should I do instead? Well, here's some things you can do. Strength training, all right? Obviously, you've probably heard this from many people. You got to work out. You got to go work out. Well, if you can strength train, you're going to build resilience. You're going to be able to be stronger and prevent re-injury. That's one part of it, okay? The other part, though, is corrective movement, right? You need to teach your body how to handle stress without pain. This is so important, right? So it's okay to strength train. That's great, but don't push through pain to build strength, okay? I always say you can't strength train your way out of this chronic pain cycle. You can obviously get stronger, which will, again, prevent re-injury. But if you're pushing through pain, not a good idea, right? So if you can do corrective movement, it can teach your body to handle stress without pain. And then last, some mobility work. So improves joint function, reduces inflammation naturally. But when you're doing mobility with your back, typically speaking, the mobility should be hip mobility, for example, right? Depending on your injury, again, I'm not diagnosing anyone here, but if you have a lumbar issue, the likelihood is you're not going to want to be doing like a bunch of like rounding of your spine. The likelihood, it's not a guarantee, but if you focus on stability at first, you're likely to build up some tolerance, and then after that, you can focus on mobility later. Okay. One thing you can do if you're really just looking to drive down your pain signals, or just find relief at the end of the day because like you're so tight and you're so sore and you're like, why? This is why I want to get the injection, because man, I don't know what to do. Like, I'm in so much pain. I need this. Well, what you can do is you can try 90-90 breathing for pain relief. Okay. So this technique will help you calm down. It will help you relax. It will get you into that rest and recovered state, which is what you want. At the end of the day, this is what you're shooting for. This is what you need to recover, what your body needs to start healing, and what it needs to drive down your pain signals. I made a video about this, about how the nervous system is truly the key here. If you can tap in to some of the things that these drugs are doing and do it naturally to drive down pain, it's just going to be to your advantage because it's a good long-term strategy. Okay, so 90-90 breathing is something like that. So what you're going to do is you're going to lie on your back with your legs elevated on a chair. Your hips and knees will be at 90 degrees. Okay, so if you're watching right now, you're like this, there's a chair here underneath, and you're resting, and then you're lying down on your back. Okay, you can put something underneath your back if you'd like, or put something underneath your head to lay back on. And then what you're going to do is you're going to deep breathe into your belly. All right, so deep belly breathing. You can put your hands on your stomach and feel it come up and down, right? Feel that breath. And what that's going to do, it's going to allow you to focus and be like, okay, am I breathing into my stomach, or am I breathing into my chest, right? And so what we want to do here is do these deep breaths, and we want to start relaxing, right? Just deep breaths, relax, stay breathing through your nose. You don't need to breathe through your mouth or anything like that. And what this is going to do, it's going to take pressure off your lower back, and it's going to calm the nerve pain that you may have, right? Or the back pain. And it encourages proper breathing mechanics and activates that deep core stability. So like just relaxing and breathing and just very, very calm, okay? This here realistically is going to be something that you can do if you're just all flared up, right? So you're in a ton of pain and you're like, oh, like I don't know what to do. You can go and you can do that, and it's going to really help you just get into that better state, okay? Well, what's the smarter way to heal your back besides injections? So we talked about this. Injections, they equal temporary relief, and they do have some side effects. If you can start to do some light breath work, some strength training, some mobility, you're going to get long-term relief with no side effects, because again, at the end of the day, like this is in your control. You're controlling it. You're taking control of your actual health, and that's the best thing you can do. Okay, so don't like you want to fix the root cause. Don't just silence the symptoms. Okay, so big thing for this. If you're wondering about like other types of injections, I do have another video that I'm gonna live that I'm gonna do later. We're gonna talk about PRP. We're gonna talk about stem cells, okay, and stuff like that. Okay, so these are like regenerative injections. Okay, so that's another episode. So if you're like, hey, what about these other ones? I will be talking about those later. So do not worry. But what you can do right now, if you're wondering, okay, like what kind of breath work can I do? What kind of strength work can I do? What kind of mobility can I do? I have a free program. You'll see the link actually below. You can comment pain free, and I'll send it to you. It's a free course program that you're going to have training and protocols that you can start to implement some of the things that I talk about. If you felt that nothing else is working, right? If you've got the injection already and that's not working, you've been seeing chiropractor, that's not working, right? I have this available to help you solve this problem and just get you build some momentum, reduce some pain. So if you want to grab that, just comment pain free in the comments and I'll send it to you. Okay. And other than that, I'm out of here. Until next time.